Hello, I'm Renia. I'm a senior care staff at Green Care Contracts. Today, I'm going to speak to you about person-centered care. Many of the people we are providing care for requires assistance with their personal care needs. And as carers, it is very important that we respect their rights, we respect their dignity, and we respect their choices by involving them in their care planning. To achieve this, we complete an assessment which considers the individual strength, which determines what the service user can do for themselves, the resources, the family, the friends, and other people who might be involved in the planning of their care. And we try to promote their independence as best as we can. And we see the things they are still capable of doing for themselves. So to deliver person-centered care, the individual's preferences and needs will build strong and trusting relationship between the staff and service user. Individuals are happy when their voices are heard. We determine the level of support required and overall their well-being, which includes mental, it includes their physical and their emotional well-being. So we put all that in place when we are doing the planning of the care. As part of the task in a person-centered needs, we also look at respect the service user's independence, and to promote them, to help them to see where they can still manage to do things themselves. Some need total personal care assistance. We have service users who might be bedbound, so they need total support. But even when they are bedbound, we find that we can encourage them maybe to wash their face, maybe to do their own makeup. It all depends with individuals. And it's important that as carers, we follow the care plan by treating everyone as an individual. And in any given setting, before we start the person-centered care, we ask for the individual's consent before we carry out any task. When assisting with personal care, it's very important that we respect the service user's privacy and dignity. We do this by making sure that the curtains or the blinds are shut, the doors are closed, the room temperature, the room is nice and warm, and before we carry out any task. It is also important that we seek consent before we carry out, even before we shut the blinds, before we close the curtains. We ask the service user for their consent. If they want to have a wash, if they want to have a half wash, we also promote that because it is their care, we are in their home, so we ask for consent in everything that we carry out. And it's important as well that we communicate with the service user throughout the process. So we go into their house, we introduce ourselves, we greet them, and we make sure that we communicate in everything that we are going to do. Ask them if they want to have their breakfast, ask them if of anything. And even when we are carrying out the task, it could be hoisting, it could be transfers, we communicate with them so that they don't feel like we are ignoring them. They feel like they are part of the plan. They feel like they are part of the task. And person-centered care looks also into the current living arrangements, which includes the environment, support, and networks. Support required, which may include mobility equipment. So if there is any mobility equipment that we need, or maybe if the service user is deteriorating, we also work with the OTs, the physiotherapists, the doctors, to make sure that we have the right equipment. And regarding risk and safety, we look into potential risk and well-being of the service user and how we can minimize the risk. Individual preferences and goals. The assessment also considers the individual's wishes by involving them in the planning of their care. The assessment may involve consulting with family and friends and paid carers to gather more information. We work with other professionals. We work with the GP, we work with the district nurses, the social workers, the occupational therapists, the dietitian. If we have a service user, maybe they are not eating well, they might need some supplement drinks, or they might need some shakes, We also work with dietitians who comes and do the assessment, and when they come and do the assessment, we are there and we are working together. We work also with physiotherapists. Also, this should be done. We do this through seeking consent from the service user. If there is anything that we need to do, if there is any professionals that need to be involved, we always make sure that we speak to the service user, we speak to the next of kin before we ask for those people to come. And as part of person-centered care, it's one of the things that is very important, that the service user is involved in everything that is happening in their home. And as for us, the care staff, we make sure to promote infection control. We make sure that we always have our PPE. We wash our hands before we put on the PPE, and wash our hands after we take off the PPE. We make sure that the PPE is disposed correctly, and if there are any pads or anything, we make sure that we put them maybe in a nappy bag, tie them, and dispose them safely. We ensure that we have all the required items when it comes to doing their personal care. It could be flannels, it could be towels, it could be creams. We make sure that all that is in the room, and we put that together before we start carrying out the task. We make sure that the temperature of the water is to the service user's choice, and in every wash, we wash starting with the face, we wash to the body, and going and finish with the bottom. And we have different flannels. We try to encourage service users to have different flannels for the face, for the body.